Alright everyone, it's time for Vermont Issues episode 64, supporting Sean Duffy on his statements regarding Vermont single payer, because PolitiFact looked at his statements on the topic. He's coming out saying, well, single payer won't work, it's a bad idea, Vermont tried it and it went bankrupt, and PolitiFact comes out and says, well, no, it didn't go bankrupt, it was never implemented to begin with. You're not understanding something here. The reason why it wasn't implemented is specifically because, hey, it's impossible to actually pay for it. Now, wouldn't you think that that would cause such a system to go bankrupt? And this is a cautionary lesson for the country at large. I know there are a lot of people out there who say, well, wouldn't it be wonderful if everyone could have free health insurance? You know, tax rates go up, cost of other government programs declines, whatever, however you pay for it you have. We'll have single payer now and people can get their treatment. It overlooks several fundamental problems with the U.S. healthcare system and indeed healthcare systems around the world. The first problem with implementing single payer is that it is unlikely that the same people who are proponents of single payer will ever agree to cutting other programs in order to pay for it. That means a massive tax increase. The order of tax increase that the state of Vermont would have had to have burdened the population with in order to pay for the program without removing other, in many cases, fundamental programs that are necessary to the stability of the state. We're talking about an enormous increase. We wouldn't really have anybody left in the state. There wouldn't be anybody to be able to afford that tax rate once you get done with it. It wouldn't have been possible. The only way I can think of on a federal level to actually pay for single payer is to reform the entire tax system so you're getting money from the big corporations, because guess what? Those little mom and pop stores and entrepreneurs that right now pay through the nose because they look rich on paper, the amount of actual tax money you get from that, look, they get screwed so they can't grow. The actual amount of tax money you're getting from them is less than the amount that you'd get if the Walmart and all these other groups were actually paying a tax rate. We'd be talking about replacing a much smaller amount, which would be cut because the tax rate overall would be lower, with a huge, huge amount of money that you'd be getting from the top level sort of multinational firms that right now don't pay anything. That probably pays for single payer in and of itself without increasing any other tax rates. In fact, you'll have dropped it for the majority of people working through upper middle class, small businesses and entrepreneurs because they're only rich on paper and most of them aren't rich anyway per se. And they're still getting hammered. So that's problem number one, is it would almost certainly, because the same party, the Democrats, that now are toying with the idea of single payer, only want to raise taxes to pay for things, never wish to cut a single program. They won't even cut military spending at this point. They haven't even suggested it in a good half decade. It's impossible to implement on that level. The second problem is that if you institute single payer, it doesn't do anything about the cost of services and goods within the medical industry. That's the problem of pharma monopolies. This is caused, again, by leftist policies. It's not caused by free market capitalism. If you had free market capitalism and some product jumps in price because they're gouging everybody, somebody else produces it and they make it cheaper. But you can't do that right now because of patent laws, copyright laws, and the government throwing free money at big pharma because they get political bribes from them. Pharma steps in. Look, here's, in a nutshell, here's how it happens. Let's say I'm pharma CEO number one. I got lots and lots of money. I give some money to some senators and House members. Don't vote for this tax reform. If you do, include a rider that'll give me a loophole. Otherwise, I might have to take my big pharma business out of your state and put it in a different state. That's how you do it. Here, I'll give you the carrot. If you don't do what I'm telling you to do, I'm going to give you the stick. And if it gets really bad, I'll just move overseas. Haha, screw you. Taking tens of thousands of jobs with me. That's what happens. Can't people who are more on the left, who do support single payer, understand why it's so expensive in our healthcare system? Can't you understand that it's not because of those evil capitalists? No, it's because the government intervenes in all of these things. If you didn't have the government intervening, there'd be nobody to bribe. You would have a free market. You couldn't give favorable treatment to these people, and they don't deserve it, generally speaking, anyway. Monsanto wouldn't be able to form a monopoly. These companies haven't argued in favor of capitalism anyway. Haven't you noticed that none of these companies ever come out and say, yeah, we want a restoration of total free market capitalism? No. They argue in favor of another government grant, or a subsidy, or some rule to suppress their competitors. So PolitiFact is basically wrong here. They're not understanding what's actually being suggested about single payer. The suggestion is not that Vermont implemented it, it ran out of money, and it was canned. The suggestion is it's impossible to pay for it, would have gone bankrupt. Peter Shumlin, himself a Democrat, the House in the state of Vermont, run by Democrats, the Senate, run by Democrats, the bureaus and the study groups, all of which were staffed by the left, all determined it was impossible to pay for single payer in our state. Is that not enough evidence for other states to be warned away from that project? Unless you are willing to make such steep cuts in other aspects of your budget that you're able to cover that without significant tax increases. I would say, if you want to rip apart a bunch of useless bureaus, if you want to get rid of the NSA, privatize the TSA, it's about time we do that. Get rid of some of the other surveillance programs and pet projects and pork barrel bullshit from the other bureaus. Why don't we get rid of the IRS too, and taxes can be a page long, and then institute tax reform. Tax reform that drops the personal income tax rate substantially, drops the business tax rate substantially, but also removes any loopholes and legalese and simplifies it so that big corporations are forced to actually pay something. Yeah, you can pay for single payer. Great idea. Okay, in that case, I wouldn't, by the way, even be averse to it. I don't have any moral quandaries about single payer, as long as you've structured things so you don't have to gouge everybody's wallets in order to implement it. And then you have to combine it with something else, which takes even more intestinal fortitude on behalf of the House and Senate, which I don't think they have, and this is why I'm pessimistic about the idea. You've got to tackle the increase in prices over time of goods. You can't do that as long as pharma companies are bribing senators and House members. They can keep their monopoly. Reforming the tax rate, great first step. That's half of it. The second half is that you need to actually have capitalism. Otherwise, the price will rise and rise because they can build whatever they want. They don't have any competitors. If you're the only company because of patent laws, you should reform those and copyright laws too. If I'm producing a product, it's really, really good, and nobody else can produce a generic alternative, a competing product under a different title that does the same thing. They can't modify it further. They can't use it in a study. They can't do anything with it other than buy it from me. I can literally charge whatever I want. Notice how the pharma companies never get in trouble for this. The last time that they kind of did was with the EpiPen, and then some group of college kids developed that generic alternative that was like, what, 1/10 the price? And they kind of looked the other way because it looked so bad for them. I don't think they wanted to drag anybody through court and put more attention on the issue. It's the last time that happened. They've got a stranglehold on the healthcare system. Therein lies the problem. And these people that are supporting single payer or Medicare for all, Medicaid for all, whatever it is, they're looking the other way when Obama was sitting down with these pharma companies and laughing it up and helping design the healthcare law that he passed. They don't even sometimes realize this. Oh, what are you talking about? He was working with the pharma companies. No, he's on the left. He cares about the little people. No, he doesn't. It did nothing to address costs. It just forced more people onto the rolls, subsidized by everybody else. That's not called morality. That's called the government wants more money to throw another social program at other people to get them to vote for them. It's just a ruse. It's not good for the economy. It's not really good for healthcare overall. It didn't address the cost. It's still rising. Implement tort reform. Doctors shouldn't have to have millions of dollars of liability insurance. For some elementary mistake, oh, I accidentally gave a patient a paper cut. Now I'm being sued for $10 million. Frivolous lawsuits. Why don't you start throwing those out? That's the problem with single payer. It won't work because it doesn't address the other fundamental issues of the problems within our healthcare system. It's all well and good to say, oh yeah, we'll raise this tax and cut that bureau and So we'll have single payer. Okay, great. A lot of people still won't want to make use of it too much because they'll be convinced, hey, it's going to fall flat at some point. It'll be like all these other well-meaning, well-intentioned social programs that keep going broke and having to be bailed out over and fucking over again. There's the problem. That's about all. Peace out.